If you're experiencing any numbness or tingling or burning sensations into the neck, into the shoulder, into the arm, you might think it's a pinched nerve. You're in the right place because I'm going to show you why this is happening and what you can do to fix it. What's going on? Dr. Nick here to talk all about this burning or this numbness, tingling going from the neck into the shoulder, into the arm. Typically it's referred to as cervical radiculopathy, just meaning referring pain going down into the arm. Now it could be kind of confusing because we might think it's like the shoulder and it's just referring into the arm, and we try to do shoulder exercises, but we're really not solving the problem because it's actually coming from the neck area. So we got to figure out what we're actually dealing with. So when we zoom out and we focus on the neck part and why it could actually create this, we have to figure out why this is happening. So in the neck we have 7 different pieces of vertebrae. So we have a bone, a disc, and a bone. That makes up a segment of the neck. We have 7 of them in the neck. Now, depending on what we're dealing with, typically when we get these radiating symptoms going down our arm, it's because we have pressure on what's called the nerve root. We have our spine, and then we have these nerves that run out each segment of the spine and go into our arms and go down to our lower body. That starts from the top, goes all the way down the spine. So, but this is just focusing on the neck. Now, when we have pressure on the nerve root, whatever nerve root that is on and those nerves supply, it can radiate into that particular segment. So in the upper neck, in the neck region, when you have pressure on the nerve root, the nerves in the upper neck supply all the way down to the arm. So those areas can be affected when you have pressure on particular segments in the cervical spine. So when we are talking about that, we're typically talking about a bulging disc, which is something that looks like this, that puts pressure on the nerve root. When that happens in the spine, it can create that numbness and burning, tingling sensation because the nerve root carries the nerves down the arm, and they can carry a sensory information, motor information, meaning movement and gripping. So sometimes we can feel weak or less strong when picking up something. We start to drop things because our nerves can be affected when we have pressure on the neck. And at the same time, the nerves have sensory information. So we can, if it's affected from a sensory aspect, that's where we can get the numbness and the tingling and the burning sensation because we have pressure on that nerve root going down into all the nerves that supply the arm. So that's how we can get those burning and those numbing, tingling sensations down the arm when it's really coming from the neck. So we have to solve it at the neck to actually solve all of this stuff. Before we dive into all the exercises, we have to focus on 2 major concepts, and that's called centralization and peripheralization. When we have symptoms that are going down our arm and going more from the spine all the way down, meaning distal or peripheralizing, that's what we don't want. We don't want our symptoms peripheralizing out from the spine. So peripheralization of here's the spine, it's peripheраting out from the spine. So peripheralization is something that we don't like and we want to get rid of, versus what's called centralization, meaning if we have all the symptoms into the hand and to the arm, it's getting closer and closer and closer to the spine. That's a good sign that you're actually making good progress in the right direction. Now, depending on the severity, how long you've been dealing with things, peripheralization and centralization can linger for quite some time, meaning the peripheralized symptoms can be weeks, months. But if you're making consistent effort to centralize your symptoms, and centralization could be meaning it comes from the forearm to the biceps, and then from the biceps to the shoulder. And as long as it's getting better and better and better, and it's getting closer and closer, centralizing more to the spine, that's a good prognostic factor in how you're actually managing the symptoms. Now, it's not to say that you're gonna centralize in one session, do one exercise, and it's completely gone. This could be a repeated thing, and it could take time, but differentiating between the two and understanding those concepts is a major factor in how you're actually responding to things, because you could do exercises and that could peripheralize the symptoms. That's something that you don't want. You don't want to peripheralize and make your symptoms worse, versus you're doing the exercises and they're centralizing. That's something that you want. And even if they're getting closer and closer to the spine and the symptoms might be getting worse, say for an example, it was in the forearm and then it's at the shoulder, but now the shoulder's worse, but it's out of the forearm. That's also a good positive thing that you want because that's centralization. It's not going more distal. It's not peripheralizing throughout this. So that's two concepts we have to consider when we're doing these exercises. All right, so the first exercise up is going to be cervical retractions. The idea behind this is from the beginning, if you remember, when we're talking about bulging discs, and that could put pressure on the nerve root, this type of exercise takes that pressure off. There's going to be some progressions to this, but we'll start with the first one and then we'll move to the progression. The idea with cervical retractions, which I typically see done wrong, is people are doing chin tucks like this. Now, when we do that, that's putting your neck into cervical flexion and then going back. A bulging disc typically gets irritated with cervical flexion. So you're actually just contributing to the problem when you do this. You want to make sure that we're not going into a chin tuck, cervical flexion, and then going backwards. And we're doing this more with intention and specificity so that we get what we're talking about. And we're getting at the actual root cause of this. So if we're sitting up nice and tall, a good cue that I like to use is think about your chin is on a level surface and you're trying to scrape the bottom of your chin across this table that you're on, this imaginary table. Or if someone's trying to kiss you, you're trying to avoid someone from kissing you. But those are some good visualizations to use throughout this so that we're doing it right. But here's how it looks. So we're up nice and tall and we're going to be just moving the head straight back. So I'm here like this. Straight back into the point where I can go to the end range and then come back. You might feel like your neck muscles are stiffening up, it feels tight. And also keep in mind when you go back, you might feel like a little bit of pinching sensations or tightness into the back of the neck. That's totally fine and normal. And then we're gonna just repeat this. Typically with this, I like to get around 15 reps, 3 sets. And with this, I like to do it more frequently, especially in the beginning when you're dealing with symptoms. I like to get this really every 2 hours throughout the day. It might seem like, oh my God, that's a lot, but it's not, because if we're sitting at a desk all day and we're like this slouched over, we're in this position for so long, we're just combating that position more frequently. And then when the symptoms decrease, then we can monitor how long we're actually doing. We don't have to do it every 2 hours. Maybe we could spread it out to every 3 hours or every 4 hours. But the idea in the beginning to especially get at these symptoms is key to do it more. So the idea, let's go over the hypothetical. We have symptoms going into the elbow right here, going into the arm. So we're going to perform cervical retractions. Now, as we go this, we want to keep in mind peripheralization or centralization. So as I do this, I go straight back, I get my symptoms going to my elbow. And I'm going to keep going. I'm going to keep mind-body connection to this and see what I feel. So I'm going to keep going. And as I get to rep 4, 5, I'm starting to feel it actually go from my elbow up to my shoulder. So that's a good sign. So I do, say, 10, and it goes from my elbow to my shoulder. Now, knowing that you just did that movement, this cervical retraction exercise, and it went from your elbow to your shoulder, that's called centralization. That is a huge positive sign, and that's an indication you want to continue doing something like this. Now, the other hypothetical scenario is, say you did 10 reps and now it goes from your elbow into your hand and it peripheralizes. That's worse. We don't want that. So we would then have to change either the amount of force that we're doing when we're going straight back, maybe the body position. Maybe you need to lie on your back and perform it. Maybe you don't have to go as hard, maybe not as many reps. You want to play with what variables you can change so that you do the exercise and it doesn't peripheralize, but it starts to centralize. So that's hypothetical 1, which is centralized. Hypothetical position 2, it peripheralized. We don't want that. Now, as you do cervical retractions, it's from the elbow, it's in the elbow going down the arm, and you're doing, say, a rep set of 10, and you get no effect to it. There's nothing going on. You did 1 set. Then you would want to repeat it again to see if it makes any change. We're trying to change this referring pain that we get. So you do another 10, and you notice it's still in the elbow, but now it's actually the volume of the intensity of the pain is decreased. It's not as bad into the elbow. It's still there, but it's not as bad when you first did it. Good positive sign. You want to keep going with that. You do another set, a set of 10. Now you notice, wow, it's really faint in my elbow and it's starting to go up a little bit. It feels much better to this area. Great. Do another set, 10. Now you're like, wow, it's completely gone on my elbow. Now it's more just in my neck. And then you keep going. You're working on that centralization and getting the symptoms away. And once the symptoms are away, that's when we want to be more mindful of the positions we're in and activities that we're doing with our neck forward flexed. So that's the idea with doing cervical retractions. We're monitoring what effect it has on the symptoms going down into the shoulder, into the arm. We're monitoring peripheralization or centralization. Overall, positives are if you keep doing cervical retractions, with the rep range that I typically like, 15 reps, 3 sets, 2 to 3 sets, and you notice it has an effect on this where your symptoms are going more from a peripheralized position all the way getting closer and closer to your neck. That's a huge positive sign. You want to keep going with that versus it's going like into the hand and it makes the hand worse. Now, another option you can do to make the symptoms feel better, you might have to do a little bit of overpressure. The idea with overpressure is if you're not making a drastic change into the elbow or into the shoulder, but you have some sort of effect, it's just slightly getting better, but it's not drastic. You might need a little bit of overpressure throughout this. So you'd perform, let's go over to the example. You'd perform the cervical retractions, it's in the elbow, you did a set of 10, and it's like, yeah, it's still there, it's slightly better, and you did multiple sets, and still just slightly there. Then we might want to add a little bit of overpressure to do this. So you have the symptoms here, it's better, but it's not the best, it's still there. So you do cervical retraction position, you take 2 fingers, put it on your chin, and you want to push straight back to basically pressure yourself further into the motion. So you're here, cervical retraction first, then push yourself, hold it. I like to hold typically 3 to 5 seconds, and then relax. And then you repeat. You first do though, cervical retraction, then overpressure, 3, 2, 1, and then repeat. Retraction, overpressure, 3, 2, 1, and relax. You would do that with the overpressure and monitor the effect it has on the symptoms. If you notice you're doing the cervical retractions and with the overpressure and it feels much better, you continue to do that because that might be the alternative that you need to get the actual effect on this. Now you also want to keep in mind the peripheralization as well with this. If you're doing more of these and it's getting into your hand, you want to modify maybe how hard you're going, how many reps, things along those lines. But you want to play with whatever you're feeling and what effect this has, the cervical retracted position, on that. The next up is nerve glides. When we have irritation to a nerve root and it's putting pressure all the way down into the nerves and it's not feeling great, the nerves don't like to be stretched. So when we hang out in stretches like this, it can actually irritate it a little bit. So nerve glides is a good way to get the nerve moving through the muscle bellies and moving through fascia in a better way. Now, there's different variations you could do where you could bias the radial nerve or the ulnar nerve or the median nerve. I'm just gonna go in this one position and the concepts will apply when we're doing this. So when we're thinking about the nerves that come from our neck all the way down into our arm, we wanna put them fully on stretch first to understand where that is. And then we want to slack it and kind of put slack on one end and stretch on the other to get the concept of what a nerve glide is, because we don't want to stretch it on both ends and irritate it. So if we're thinking our nerves, I'll demo on this arm. So if we're thinking our nerves are coming from our neck, going down to our shoulder, into our elbow, into our forearm, into our hands. So if we want to stretch all of this stuff all through here, we want to just elongate it like this. So you can imagine if all the nerves are coming out, this would be putting it on full stretch like this. Now when the nerve is irritated, nerves are irritated from a bulging disc at the neck, and this position is not going to feel great because it's going to feel a lot of tension. So we want to slack it in certain ways. So if you can imagine all this is being stretched, we don't want to do this, but we want to mobilize it where we're slacking it on one end and stretching on the other end. So hypothetical. If I go like this with my head, I'd be slacking the nerves all through here, but stretching it really through here, right? Then vice versa, if I pull my head this way, but I bring my arm back, now I'm slacking it here, but I'm stretching it here. So we can mobilize it like this and just get the input into the upper body of the neck and the arm that we're just mobilizing all of the nerve tissue that is really just kind of pissed off at the moment, because when we have that nerve root irritation, the nerves are sensitive. They don't want to be stretched. Nerves don't like to be stretched. So mobilizing them is key with this, and working on mobility around muscles and joints helps the nerves move better. So when we do this, we want to take the concept of making mobility changes at the joint level and the muscle level, but not stretching at a nerve level. So the concept again will be here. I'm just going to demo in this position. We're not biasing like the ulnar nerve or the median nerve. This would be really the median nerve though, if we're really trying to bias at this, but the concept's here. So if all this stuff is being irritated when we're stretching it, I'm going to bend my head this way and go like this. So I'm slacking at my neck, stretching at my arm. Now I'm stretching it at my neck, slackening at my arm. And you just mobilize back and forth. With nerve mobilizations, I like to typically get around more reps, so 15, 20 of these, and doing multiple times throughout the day. More input to make this stuff feel better is the idea. And you also want to zoom out and take the concept of how you feel after you're done doing them. So if you're done doing them and you're like, wow, my symptoms are way worse, well then don't do it, right? You don't want to make your symptoms worse, but you want to have that as information. So you just did all this, well, did you do it right? How many reps did you do? Did you do it too intense? How frequently are you doing it? Are you really pushing the end ranges? You want to get the information that when you're doing them, but your response to it. So if your response is way worse, scale back. It might not be that that exercise is bad for you, but maybe how you're performing it and all these other things that factor into it. Or the other way, you feel like you're doing it, like, wow, I feel much better. Well, great, green light. Keep upping it and keep doing it because you're only putting good input into the body. The third exercise is a simple postural awareness exercise. We got to work on getting more mind-body connection to how we're actually sitting. A lot of times we are at desk jobs, we're sitting for 8 hours a day, and we're in all this crunched position, and we wonder why we're all stiff, tight, and we have all these issues. So doing more mind-body connection, or maybe setting a timer and working on a postural exercise like this is key throughout the day, just to get your body in and out of positions. Now, there is no one right way of posture. Sitting like this all day is not good posture. Likewise, sitting like this all day is not bad posture. Getting in and out of positions is the best posture. Sitting like this all day could be bad posture. Sitting like this all day could be bad posture. When we're sitting, but typically our body follows the path of least resistance. So when we're sitting like this all day and we get up, we start to feel better. So we just immediately think, oh, it must be more upright. But it's not the case, because if we're all upright like this, we're getting all stiffness and we're just so guarded with everything. So get in and out of positions. That is the best posture. A little bit like this, a little bit like this, a little bit like this. Move your body. That's the thing. Set a timer, move. So here's a simple exercise. So you're here just like this. We're gonna use our arms to think about pushing through our body. We're gonna be working on one to actually get ourselves up, because commonly we're just slouched. So from here, I'm gonna think about bringing my arms through my body and getting my chest up tall to the ceiling. So from here, I'm gonna just exaggerate. I'll slouch like this, but now I'm gonna push through and pull my chest up towards the ceiling. Now, when I'm doing this, I feel my back muscles on and working. I feel the side of my lats, I feel my upper back working, and I'm really visualizing, thinking of pushing through my legs. This will help get me in more of an upright position and activate all of the back muscles that help us from a postural standpoint. Now this, I like to get duration. So 10-second holds and then relax. Why duration? Because our postural muscles are working more of an endurance standpoint. We're not really getting power out of our endurance postural muscles, right? We're not just like powering up like this to get reps. We're trying to hold our body up and function through life. So I like to get more duration with this. So I like to hold for 10 seconds or 5 seconds, whatever you feel like is making a dent in your progress with it. Hold and then relax. So I'm pulling through, getting upright. I feel my back, my lat muscles working. Feels really good in my middle back. Hold, and then relax. Pull up, 10, 9, 8, 0, and then relax. You'd want to do multiple reps. Say if you did 10-second holds, you did 6 of them, that's a minute. You do 3 rounds, that's 3 minutes of input into the body. Typically with tissue change, we want 2 minutes. So if you do 3 minutes a day, or 3 minutes in the morning, 3 minutes in the afternoon, 3 minutes in the evening, that's good input into getting your body more in an upright position and getting out of positions. It's a simple one you could do at work. Set timers. That typically helps a lot of clients that I work with to remind themselves to actually get in the habit of getting themselves up. This will play a good role into this neck position and going down the arm, because we'll be more upright, which leads to less likelihood of the neck falling down, which puts the pressure on the disc, which then puts the pressure on the nerve root. So if we just fix this posture and get upright, it helps us out a ton. Well, there you go. I hope you did find value in this video. I went over 3 main exercises to help all this radiating and nerve feeling sensations going down the arm. And I really hope this gave you valuable insight and exercises that you could really take away from this video and perform. And I really do hope it was helpful. If it was helpful, I'd really greatly appreciate it if you support my channel by subscribing down below to the channel, like this video, leave any comments down below in the section, and I will see you on the next one.